Hello everyone, myself Dr. Kanchan Sharma and welcome to my YouTube channel. So today's topic is fibroid in uterus. Yes, fibroids are so common nowadays, even more than 1 million cases registered per year in India. Yes, it's true. Women usually have fibroids in their 30s, 40s and early 50s, not after 50 or in their menopausal age, because after menopause they usually get shrunk, but it can appear at any age. What is fibroid? What are the causes? What are the symptoms? And at last I will share very effective Ayurvedic treatment with you. So let's start the video. But please do subscribe my channel and hit the bell icon to get updated with all my latest videos. So the uterus is pear-shaped upside down female organ, and uterus is made of 3 muscular layers. The outer one is perimetrium, the middle one is myometrium and the inner one is endometrium, and usually fibroids appear in these muscular layers. So if fibroid develop in the outermost layer, it is called subserosal fibroid. If it develops in the myometrium in middle layer, it is called intramural fibroid, and this is the most common fibroid. And if it develops in the lining of endometrium, fibroid is situated in the uterine cavity, then it is called submucosal fibroid, and submucosal fibroid usually create difficulty in bleeding, infertility problems. So you can see the shape, the location and the size of a fibroid can vary. In Ayurveda, there is a clear reason. Yes, there is a description, there is a clear reason. So the kapha dosha imbalance is the reason. If your body having kapha dosha imbalance or your kapha is increasing, and there may be vata is also involved in some person, but the main dushti is of kapha, and in Ayurveda we call it garbhashaya granthi. So if you have small fibroid, it is not necessary that you feel any kind of symptoms. Mostly in small fibroids, patient is asymptomatic, and accidentally, like you are going for ultrasound for any other reason and you got this news that you are having fibroids in your uterus. So usually they are asymptomatic, but if you are having moderate or large size of fibroid, you may experience painful, heavy, irregular bleeding. And because of that, patient is usually anemic, and a patient feel weakness, palpitation, and other than that you may feel a fullness in lower abdomen, like there is something in your lower abdomen. Frequent urination is other symptom. Constipation can be there, or a low back ache is there, heavy vaginal discharge is there. So these are the symptoms. So with these symptoms, when you go to your gynae, they usually examine you by manually. They will do per vaginal examination, and they can advise you for ultrasound to know exact location and size of the fibroid. The Ayurvedic treatment. In Ayurveda, diet plays important role. So first we will talk about the diet. So we have to take that kind of diet which is not increasing your kapha dosha, because kapha dosha is the reason. So I am going to tell you what you have to avoid. So you have to avoid refined flour, refined oil, refined salt, refined sugar. Avoid caffeine, avoid alcohol. Avoid smoking also. Avoid excess intake of yogurt and dairy products. You can only consume cow milk. Well, try to avoid non-veg diet and accept honey, avoid all the sweeteners. And at last, my advice is to add some spices in your diet like cumin, carom, cinnamon, ginger. Try to add all spices in your food because it decreases the kapha dosha. In Ayurveda, we have to analyze the prakriti and dosha imbalance of the patient. So if you want to book an Ayurveda consultation with me, you can book by this WhatsApp number. But now let's move towards the generalized treatment of the fibroid. So the first preparation is take giloya satva 500 mg. Take shila sindoor 50 mg and take Prawal pisthi 125 mg. Mix it well, mix it with honey and take it half an hour before your meal, before your breakfast, before your dinner. The second preparation is Kanchanar Gogul. The third preparation is Chandraprabhavati. Take both of these 2 tablets twice a day after half an hour of your meal. You have to take this with ginger, cinnamon, water. How we can make this water? It is very easy. Take half inch of ginger, 1 inch of cinnamon and put it in 1 glass of hot boiled water and leave it for 1 hour. Then filter it. This is your ginger cinnamon water is ready, and take those tablets with this water. So the fourth one is Varanadi Kashaya tablet. This is also very effective. You have to take all these 4 preparations together. So take these treatment for 2 to 3 months, and definitely your fibroids will be shrink, and definitely you will get the result. And if you want to consult me, you can also consult. If you have any query, you can ask in comment section. So I hope you like the video. Thanks for watching my video.